Male hypoactive sexual desire disorder represents one of the most misunderstood and underdiagnosed conditions in contemporary sexual medicine. This complex psychological and physiological condition affects millions of men worldwide, yet it remains shrouded in silence due to societal expectations and masculine stereotypes that perpetuate the myth that men should always be ready and willing to engage in sexual activity. The disorder is characterized by a persistent or recurrent lack of sexual fantasies and desire for sexual activity, causing significant distress or interpersonal difficulties. Unlike temporary fluctuations in libido that naturally occur throughout life, male hypoactive sexual desire disorder represents a sustained pattern that interferes with quality of life and intimate relationships. The condition challenges traditional assumptions about male sexuality, revealing that men, like women, can experience profound variations in sexual desire that require medical attention and understanding. Understanding the etiology of male hypoactive sexual desire disorder requires examining multiple interconnected factors. Biological causes include hormonal imbalances, particularly low testosterone levels, which can significantly impact sexual motivation and arousal. Chronic medical conditions such as diabetes, cardiovascular disease, and neurological disorders can disrupt the delicate physiological processes that govern sexual desire. Medications commonly prescribed for depression, anxiety, and hypertension often have side effects that suppress libido, creating a complex interplay between mental health treatment and sexual wellness. Psychological factors play an equally important role in the development and maintenance of male hypoactive sexual desire disorder. Depression and anxiety disorders frequently co-occur with sexual dysfunction, creating a cyclical pattern where reduced sexual desire contributes to emotional distress, which further diminishes sexual interest. Stress from work, financial pressures, or relationship conflicts can overwhelm the mind's capacity to experience sexual desire, redirecting mental energy towards survival concerns rather than intimacy and pleasure. The diagnostic process for male hypoactive sexual desire disorder involves comprehensive evaluation by qualified healthcare professionals. Clinicians must distinguish between normal variations in sexual desire and clinically significant dysfunction that warrants intervention. The assessment typically includes detailed sexual history, medical examination, laboratory tests to evaluate hormone levels, and psychological evaluation to identify contributing mental health factors. This thorough approach ensures accurate diagnosis and appropriate treatment planning. Treatment approaches for male hypoactive sexual desire disorder are multifaceted and individualized based on underlying causes and patient preferences. Medical interventions may include hormone replacement therapy for men with documented testosterone deficiency, adjustment of medications that suppress libido, or treatment of underlying medical conditions contributing to sexual dysfunction. Psychological interventions, including cognitive behavioral therapy and couples counseling, address emotional and relational factors that may be inhibiting sexual desire. The impact of male hypoactive sexual desire disorder extends far beyond individual suffering, affecting intimate partnerships and family dynamics. Partners may interpret reduced sexual interest as rejection or loss of attraction, leading to communication breakdowns and relationship deterioration. Understanding that decreased sexual desire represents a medical condition rather than a personal failure helps couples approach the issue with compassion and collaboration rather than blame and resentment. Lifestyle modifications can significantly improve outcomes for men with hypoactive sexual desire disorder. Regular exercise enhances blood flow, reduces stress, and can naturally boost testosterone levels. Adequate sleep is crucial for hormonal regulation and overall sexual health. Stress management techniques, including meditation and mindfulness practices, can help men reconnect with their bodies and sexual feelings. Dietary changes that support cardiovascular health also benefit sexual function. Communication strategies are essential for managing male hypoactive sexual desire disorder within relationships. Open dialogue about sexual needs, expectations, and concerns helps partners understand each other's perspectives and work together toward solutions. Professional counseling provides a safe space to explore sensitive topics and develop effective communication skills. Education about normal sexual functioning and age-related changes helps normalize experiences and reduce anxiety about sexual performance. The prognosis for male hypoactive sexual desire disorder is generally favorable when properly diagnosed and treated. Many men experience significant improvement in sexual desire and overall quality of life with appropriate intervention. However, treatment success depends on accurate identification of contributing factors, patient commitment to therapy, and ongoing support from healthcare providers and partners. Long-term management may be necessary for some individuals, particularly those with chronic medical conditions or persistent psychological factors. Prevention strategies for male hypoactive sexual desire disorder focus on maintaining overall health and addressing risk factors before they significantly impact sexual function. Regular medical checkups can identify and treat conditions that may affect sexual desire. Stress management and mental health care help prevent psychological factors from overwhelming sexual interest. Maintaining healthy relationships through communication and intimacy-building activities supports ongoing sexual connection. Male hypoactive sexual desire disorder represents a legitimate medical condition that deserves recognition, understanding, and appropriate treatment. By acknowledging that men can experience significant variations in sexual desire, we can reduce stigma and encourage help-seeking behavior. Comprehensive evaluation and individualized treatment approaches offer hope for men suffering from this condition and their partners, emphasizing that sexual wellness is an important component of overall health and quality of life that deserves professional attention and support.